السلام عليكم ورحمة الله وبركاته جميعا. Would like to welcome you all to this webinar as a series being organized by the Saudi EduPlat team, and can't find the words really to thank them all. And thank you to Dr. Sulafa Alqutub, who is going to present very important presentation during this critical time for our healthcare systems locally and even globally. I'd like to even thank you all for attending. I wish you really enjoy the presentation. I'm not going to take time. Without further ado, I'll let the floor for Dr. Sulafa Alqutub just to lead the discussion. And I welcome you all. I see the people are coming in. And I hope you really enjoy it. By the way, this presentation will be made available on our platform at www.saudiedublat.org. So you could access it, and then you can actually put your comments, and you can enable the social media buttons over there, and you can interact afterward with Dr. Sulafa, who is also joining us on the platform. I'm going to type to you the location of our platform. Please go and register. It's for free. And we welcome people with various qualifications to join us to deliver presentations and webinars. God bless you. This is voluntary work, and نقدر كل الأعمال التطوعية. شكرا دكتورة سلاف, and the mic is for you now.
Thank you, Dr. Abdullah, for this nice invitation. And
Dr. Sulafa, please put your mic on again, please. I think you turned it off. Dr. Sulafa, can you just turn your microphone on? It's in the bottom of your screen, Dr. Sulafa. You can turn it on. Can you hear us now, Dr. Sulafa?
can you hear me now?
Yeah, I can hear you. So you can put your presentation
Okay.
on.
Okay. We were just starting up talking about the reason why do we select this topic and why now. We have this presentation to answer some questions on how to assure the sustainability of health system after passing this current pandemic. The first part of this webinar will cover the basic framework of the WHO system building blocks and the interplay of the system components, keeping an eye on the catalyst and the boosters that allow the system to achieve the main expected outcomes. The second part of the webinar will cover basically the best practice and interventions value system to the old volume-based system, and how does our national transformation plan construct was theoretically developed. The third part of this webinar will cover some of the commonly observed problems across the globe, with a focus on the workforce supply and health system finance. The last section and few slides will have suggestions on the intervention to Saudi Arabian health system finance based on what was proposed by the WHO 2010 report on efficient financing of the health system. Okay, we'll move on now to show you what are the main contents and objectives of our webinar. Basically, the healthcare system building blocks, definition, some of the definitions of the system building blocks, main functions and interventions, the Eastern Mediterranean region suggested framework on health system response indicators, WHO recommendation for efficient financing, Saudi National Transformation Plan components, essential components, and the World Bank data on Saudi Arabian financial profile, and our suggested interventions. You may all be familiar with this WHO health system framework, which was developed in 2008. The basic building blocks include service delivery, health workforce, information, medical product, vaccines, technologies, finance, and leadership. Those are the inputs of the system. In the middle, you can see the access and coverage, quality and safety as a booster and catalyst to the intended outcome, which is the overall goals, outcomes, including the improvement in population health with an eye on equity, responsiveness of the health system, social and financial risk protections, and improvement in the efficiencies. What is the essential definition of the health system suggested by the WHO? Health system consists of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. Like any other system, it is a set of interconnected parts that have to function together to be effective. Patients, families, communities, Ministry of Health, other health providers, health financing bodies. And the seventh building block usually is considered as people. Who are those people? Individuals, households, communities, civil societies, consumers, patients, payers, producers, population behavior, attitudes toward this system, attitude toward their health, behavior toward this system, behavior toward their health, and so on and so forth. We are blessed in Saudi Arabia. We have a lot of regulatory, governing, providing organizations within Saudi Arabia. We have the Saudi Health Council. We have the Saudi Commission for Health Specialties. We have the Council of Cooperative Health Insurance, Sibahi, Food and Drug Authority, Wiqaya, Saudi Red Crescent, other health providers such as Ministry of Health, King Faisal. Hopefully I did not miss anybody. So we have regulatory, governing, and provider organizations. Plus also university hospitals, the non-for-profit organization, or the charity organizations, also the health insurance as a providers, the private health insurance. Let me just give you a brief idea about the pillars of sustainable health system. which were proposed by Canadian system. They are not different than the one which was proposed, the framework which was proposed by the WHO, but they their focus is mainly on human workforce, human resources and human workforce. They are suggesting an optimal development, alignment, and support of the human resources, along with protecting, nurturing, developing the formal and informal workforce. This include, but not limited to, volunteering workforce, home healthcare workforce. They suggested that in order to have a sustainable health system, you have to anticipate and plan for the shift in supply and demand in workforce as a whole and in other building blocks that we are mentioned in the WHO framework, such as access to care, innovative delivery models, mobilizing and coordinating actions across sectors, making the health for all, strategic alignment with the determinants of health with other sectors, such as education sectors, economic and social sectors. Also, an eye on anticipated demand and anticipated supply to prevent the shortage and to prevent the surplus. So the need is to have a sustainable health system is just to reach this equilibrium point without shortage or surplus. I want to make sure that you can hear me all. Everybody's just... Dr. Abdullah, are you in?
I am in, Dr. Sulafa. I am in. I'll have to mute my microphone so that I don't have to make any sound interference. Thank you.
Okay, thank you so much, Dr. Abdullah. Just a checkpoint. Thank you. Okay. So what are the criteria of system building blocks? Here is a basic checklist when you are planning for a sustainable health system in each country. Service delivery. Service delivery should be good, comprised of quality, access, safety, and coverage with focus on prevention and public health services. Health workforce. A well-performing workforce consists of human resource management skills and policies, and I believe that هيئة التخصصات الصحية Saudi Council is doing a great job in this. Health information system, a well-performing system, ensures the production, analysis, dissemination, and use of timely, reliable information. We have promising information system development, and I believe also Ministry of Health is just applying a plethora of applications, analysis for the population health. Medical products producing and supplying programs need to ensure equitable access, assure quality, cost-effective use. Financing is another system building blocks, which is should comprise of raising adequate fund for health, protecting people from a catastrophic financial problems, allocate resources and purchase goods and services in a way to improve quality, equity, and efficiency. Last but not least, the leadership and governance. A good and effective leadership and governance should ensure the existence of strategic policy framework, effective oversight, and coalition and attention system design. By the end, all the regulatory bodies and providers should have an eye on the three goals: universal access, equity, and equalization of social gradient. We shouldn't have people who suffer and who cannot access the healthcare. I believe Kingdom of Saudi Arabia is just doing a great job, especially right now during the pandemic, where King Salman Al Saud released a decree of just accepting even the illegal people to get into the system. This is an example of an equity where everybody can access the health system. Also, high quality is another goal of a sustainable health system, and cost containment is the third goal. This slide is showing the framework suggested by Eastern Mediterranean Regional Office in 2015 to assess the core indicators of the health determinants and risk, health status, and health system response. And in this presentation, we are just focusing on health system response, where all health systems in the Eastern Mediterranean region. Yes, doctor.
Could you please download your presentation to the audience so that they can read with you on their devices? Because apparently you have internet problems. The clarity of your presentation.
I will do now. Yes, sure.
Just go to the slide.
As an example of comparison between evaluating the health system performance, this table is showing the 2013 ranking, and this table is showing the 2017 for the Commonwealth Fund countries. As you can see, countries are just changing in overall ranking from the second in 2013 to, you can see Switzerland just ranked 6 in 2017. Basically, this is a kind of evaluating the performance of healthcare system. I put this just slide for the comparison, and you can see how countries are just evaluated, and the health system performance in each country is being evaluated and ranked. The second section of our presentation is going to be about the best practice intervention globally and nationally. This is another important definition for the health care system, which is the healthcare economic system. Is defined as a collection of economic units, agents, and institutions that interact coherently, adapting and adjusting to the social and physical environment. Health system is called as a complex adaptive system. What does this mean? For the functions where the health system is performing, the health system should perform in coordination for the adjustment, for the coherence, and for the adaptation. For the adjustment part of it, it means that transforming, redistributing resources to improve function. Also, make a best utilization of opportunities, resolve weaknesses and within the existing institutions. About the coherence, it includes evolving or planning new institutions or to solve problems, and usually the problems are mainly financial problems. With regard to the coherence, we have coherence, adaptation, and adjustment. Adjustment, as I mentioned, it's a transformation. Adaptation is evolving or planning, and the coherence, which is a degree to which organizations and workforce coordinate and integrate their activity for a common purpose and goal on a harmony with consideration to incentives. So, in order to have a functioning health system, you should have coordination between the three pillars here, or the three circles here. And all the interplaying part of it should work toward this. This is an example. The Health Maintenance Organization is an example of adaptation and is being in place in United States health system for the last maybe 50 or 60 years. This model is not the best model. That's why they developed over the last 10 years another model, which is going to be mentioned in the next slide. But this model is essential because it forms a foundation for the new model. The Health Maintenance Organization is usually was targeting health provision, and they were not targeting the quality of care. It has got three models: the staff model, the group model, and network model. The staff model basically was based on one treating physician is the gatekeeper for the service with one hospital. The group model contract with a group of physicians or hospitals, while the network model for the Health Maintenance Organization contract is with more specialties and more than one group of hospitals. It is quite similar to the accountable care organization, but again, the typical health maintenance organizations were not targeting improvement of quality of care. What makes the accountable care organization more customer-oriented and quality-driven? Because it focuses on sharing the risk of cost between the provider and the beneficiary, المستفيد والمقدم الخدمة. So, financial incentives and payment structure focused around quality performance and shared risk. Also, it focuses on less fee for service and more of structure to share financial risk between providers and insurers. Patient choices are more freely. Participant is voluntary, and patient can choose any primary care physician, specialist, or hospital. So, no forcing the patient to choose. They are not forcing the patient to choose like the old classic health maintenance organization. Also, it is not insurance companies driven. It depends on the provider-led organization and no pre-approval process required. So it is a customer-oriented, quality-driven with cost sharing. This was all about accountable care organization. Again, they are not the best practice, but they proved its effectiveness and in value-driven versus volume-driven. So, as you can see here, value-driven healthcare, where the quality is just getting better with lower cost. The classic model of financial provision was basically based on volume-driven with high cost. Also, this slide is just showing how is the targeted, value-driven, value-based shift is important in allowing the person, the patients or the care recipient to partner in their care with the continuous cost reduction and waste reduction, and with focus on delivery side versus the all-purpose hospital and facilities, with the quality of improvement in daily work for all staff, versus the old volume driven or volume based, which was quality department as an expert. Common syndromes in workforce and financing is the third section. There are two important components of the system building blocks, which are the health workforce and the finance. The health workforce is produced by a pipeline. This means they enter and they exit. The exit is usually either through migration, job change, death, or disability. Labor market usually is affected by global and local demand. Workforce syndromes globally or locally are either shortage or gender geographic institutional imbalance or a spatial maldistribution. The problems with workforce are led by household demand, financing and incentives for the workforce, and workforce information system. So if we want to manage the workforce syndromes, we should work on the determinants, the reasons where the will lead to the shortage, gender, and for example, if we have, and this is maybe we face it in day-to-day basis, the workforce information system is just disintegrated. You might have an information, you won't be able to get a reliable, timely information about the distribution of the workforce information. This is because maybe the no update, or there was a demand or a quick change in the workforce distribution made it just not made the information available is not readily and not in a timely fashion. So you might have delay in reporting or reporting the distribution of some specialty, and so on and so forth. So the problem with the workforce information should be resolved in order to make sure that you won't have the shortage problem, you won't have the spatial maldistribution problem, you won't have the geographic institutional imbalance in the workforce. This was about brief, there are books and articles discussing the issues related to the workforce, but this was just brief. This is very important slide. Which conclude the recommendation of WHO for efficient financing. It includes the effective spending, allocation, and raising. Effective spending, spending more money effectively in a way of producing more locally developed medicine and supplies. What does this mean? Means that invest in developing or supporting investment in locally developed medicines and supplies like gloves, medical supplies, and all kinds of supplies. The second important strategy about the effective spending is they suggest that to target the total spending per capita in low-income countries to $60 by 2015. Another recommendation about allocating the fund in the national budget, which includes all local, allocate at least 15% of the government fund on health spending. The other strategy is to do an efficient tax collection by earmarking of the VAT or the sin tax. Also allocate at least 0.7% of the GDP for the development assistance and consultancy. I think since the development of 2030, Vision 2030, we are doing good in this part of it, the national budget and the allocation. For the third recommendation, which includes raise money more fairly by reducing a direct out-of-pocket payment and by implementing a value-based payment and social health insurance. So what we have done so far in Saudi Arabia, we are doing great with regard to developing a new model of care. We, within the transformation plan, health transformation plan. And for those who doesn't know the main pillars of National Transformation Plan, this is the diagram is showing the new model of care, the financing system, the public-private partnership, the human capital, and so on and so forth. Here, this slide is showing that government expenditure on health as a percentage of total government expenditure for various regions of the WHO regions. And as you can see here, Saudi Arabia is within the Eastern Mediterranean region countries, and they report the least, 7% an average of government expenditure on health. So what is the suggested solution to the Eastern Mediterranean region, including the Saudi Arabia, is to raise the fund through allocating at least 15% of the government expenditure on health. Here is another slide which shows the out-of-pocket payment as a catastrophic financial effect and its escalation with regard to increase in age. What is the solution? Is to raise money fairly to minimize out-of-pocket catastrophe. The coming few slides are showing the World Bank data on Saudi Arabian financial profile. Unfortunately, I couldn't get the profile after the 2015, I think because the World Bank doesn't have the data. But we can see here the share out of pocket, the direct household payment for the total current health expenditure within Saudi Arabia. The maximum reported was just maybe less than 20, and then it shows a decline in 2015 to less than about 14. So what is the solution? Is to continue with the reduction in out-of-pocket share payment in order to prevent the catastrophic poverty and catastrophic events of related to the high cost of health expenditure by individuals. Here is another slide which is showing the domestic general government health expenditure, which represent 10% of out of general expenditure. As we've mentioned before, that this is an indicator for the health system performance. And this indicator is specifically, it indicates the government priority to spend on health from own domestic public resources. So, as you can see here in 2015, it raised up to 10% out of the general expenditure. What is the suggested solution based on the WHO recommendation on financial efficiency is to increase the health expenditure up to 15% out of the government fund or budget. Here is another slide which shows the median health expenditure per capita. And you can see here the escalation in out of health expenditure per capita, median health expenditure per capita, which is $1,250 in 2015. And what is the suggested solution? Is to spend money more efficiently by locally developing medicine and supplies. Eventually, this will make the expenditure less per capita. Median out-of-pocket expenditure per capita, and you can see also the escalation here, where 2015 they reported more than $175 per capita out of pocket. How to mitigate this? By implementing social health insurance. This also based on the WHO report recommendation. Here is another data, which is like a graph, shows that the highest consumed GDP, which is 6%. This indicator does not include capital health expenditure such as building. And as you know, GDP is a reflection of economic output and standards of living. What do you think is the corrective plan? Is to minimize the waste and keep the balance between the GDP spending and revenue in relation to the health expenditure to prevent budget deficit. Finally, here is the list of references, and the floor is open just for discussion. Thank you so much.